Thank you, everyone. Thank you, Louis, for the introduction. Can everybody hear me well enough? Is that loud enough? Thank you to Dr. Scott for the introduction and the opportunity. Thank you all for being here, and thank you to the IT department for setting this up. I'm going to put the presentation up. Can you see that? Is that coming through?
Yes.
Okay, great. So we have two presentations from me this morning, and the first one is more of an introductory one to really look at the history behind concussion and give you all some background as to why it's so important that we manage this condition and we manage it together around the world in a similar way. I really want to commend you for taking this on. And I think in your region, you could really set the standards for managing concussion. So I look forward to being part of that. That's my conflict of interest disclosure, nothing that's relevant to this talk this morning. I really just want to emphasize that concussion is not new. It goes back thousands of years to when the gladiators were fighting. There were obviously head injuries at that stage, and one of the difficulties with concussion is that there is no visible wound. You can't really see what is happening to the injured brain, and so you have to have processes in place which help you determine when the recovery has taken place, and we haven't always had those until recently, and that's really what we have to try and implement. Concussion is part of a spectrum of traumatic brain injury. And when we look at that spectrum, we're probably better trained in dealing with what you see on the right-hand side here in terms of the more severe types of brain injuries, which neurosurgeons deal with, which may be presented at motor vehicle accidents, in the emergency room, etc. Concussion tends to be more at the other end of the spectrum, but cover a range of conditions. And because it's not often seen as an emergency, and because it's not that clinically apparent always, it's more difficult actually to treat. And so historically, up until 15 years ago or so, there were only really two criteria for diagnosing a concussion. You had to either have lost consciousness or lost memory, had amnesia. And if neither of those were present, then you weren't diagnosed as being concussed. What we've realized in subsequent years, as various scientific researchers come to the fore and consensus meetings are taking place, is that there are more than 20 signs and symptoms which we now recognize as being part of the spectrum that might present in an individual whose brain has suffered some sort of traumatic injury. And those signs and symptoms may be physical, like headache, like dizziness, like nausea and vomiting, those sort of things. They may be cognitive, like loss of concentration, loss of memory, emotional, aggression, irritability, sleep disturbances, sleeping more, not being able to sleep, and balance disturbances. So I'd fit them into those 5 groups. And in fact, only 10% of patients now diagnosed as having concussion will have lost consciousness. So I think that's an important take-home message, that just because someone has not lost consciousness doesn't mean that they have not suffered any brain injury. So I think we now realize that concussion is a potentially serious injury, and as clinicians, up until the last couple of decades, we've really been found wanting with regards to a more objective assessment protocol. And those protocols have been instituted since 2001. And the latest ones, for those of you who were at our presentation earlier this year, come from the consensus meeting at the end of 2016. So the information we're going to discuss today is very up to date. Now, traumatic brain injury, some people refer to concussion as a mild traumatic brain injury, but we tend to try and avoid the word mild because it might lead to the suggestion that it doesn't have to be taken seriously. But the difficulty with this, as I mentioned, is that it's an invisible brain injury. There's no detectable hemorrhage or injury that can be seen on the scans, but it does result from acceleration, deceleration, and rotational injury that causes damage to neurons and axons, and may also result in damage to associated regions such as the cranial nerves and the neck. And all those need to be assessed. And one of the messages I want to get across is that the group of you sitting there are in the best position to assess this and manage it, because you are clinicians, and it requires clinicians to diagnose concussion, not computers or scans. These are the important papers, the landmark discussion documents, which you should be familiar with, and I think you should take some time to read through these and determine the trends in concussion management. And then most importantly, the consensus documents, of which there are consensus papers and 12 supporting papers in 2 editions of the British Journal of Sports Medicine published earlier this year. So those, I think, for those of you involved in concussion management, you should really become very familiar with, and would provide very useful background and information as to why we have the protocols that we do. That's just a picture of that consensus conference and the delegates. It was really a meeting of 400 world experts, clinicians and scientists from all corners of the globe who could contribute to the latest in research and clinical input in terms of concussion management. The key messages are really described in these 11 points here, and I'm not going to go through all of them. They were covered in the talk I gave earlier in the year, which Dr. Holzhausen has, and which are covered nicely in this journal, which again I suggest you read. What we're really going to do today is summarize the take-home messages and then look at how we can implement those in clinical protocols that you can put into play on the field, on the side of the field, and in your follow-up management, together with the Aspetar Sport Related Concussion Clinic, who is going to be coordinating these protocols. The first message is that concussion represents a serious neurological injury that may present with a wide spectrum of symptoms and signs. Previously, our assessment protocols were subjective and inconsistent. One of the things we're going to emphasize is the need for serial clinical assessments. In other words, repeated evaluation of the suspected concussed player. From the time the injury takes place on the field, to repeating those evaluations on the field side, to the referral process to the sports concussion clinic, hospital, wherever is indicated, to the follow-up return to sport program. Emergence of computerized testing, which will be covered during today's seminar by one of the other speakers, has helped in terms of being one additional tool that we can use. And then one of the things I like to emphasize is what we're doing today and what you will need to do as clinicians involved in concussion management is ongoing education. Because you need everybody to understand what you're trying to do, whether they are one of your players, whether they're the parents of a player, whether they're the coaches and management, or whether they're your colleagues with whom you're working. I think that's very important that everybody understands it. And it's not always an easy process. It's a political one in some instances. Some people feel that you're working against them as medical clinicians. And one of my messages is always that we are all working in the interests of the athlete and in the interests of sport, and we need to understand why we're doing that. And I'll elaborate on the education side during the course of the morning. And then the final theme that emerged from 2016 is that concussion is a treatable condition. And you have some very good physiotherapists associated with the Aspetar Sports Concussion Clinic who will be emphasizing the interventions in terms of addressing particularly neck-related pain, some of the headaches, and some of the oculovestibular and balance issues related to concussion, which will actually help speed recovery. So that for me are the key. Those are the key aspects. This is a slide which Dr. Paul McCrory from Australia, a sports physician and neurologist, has come up with, which I think very nicely and succinctly summarizes the components associated with concussion presentation, the potential interventions in terms of diagnosis and in terms of management. But it's quite a complicated slide. It's one that I like to show, and one that I keep in my office because I think it's inspirational, and it shows you where we should be heading in terms of complete concussion care. But if you're starting out as a team physician or as a paramedical support person for concussion, it's quite complicated. So what I thought we'd do, we try and make it a lot simpler by trying to show as team physicians how we can more easily implement a concussion program. So I'm going to start by looking at what we mean by the sports concussion team and who should be making up that team. Because that team should aim for comprehensive concussion care and, most importantly, safe return to play or return to sport. Our aims are to institute evidence-based protocols, to institute best practice based on the evidence we have, to become competent health professionals in the management of concussion, to have the right equipment and resources for intervention, to have a program that's cost efficient and user friendly, and to be a source of education and support for players, for management, and for our colleagues as well. So I like to talk about this concept of an advanced care setting for concussion. And that best care practice really revolves around a multidisciplinary team. As team clinicians, as people associated with your sports teams, you are really the central role players. But it makes sense to have people supporting you, and those people will include physiotherapists, paramedics in an ambulance service, neurosurgeons and neurologists at your referral hospitals, neuropsychologists, radiologists, and sports physicians in your network, particularly at Aspetar. In addition, very important role players who people don't always think about are exercise and physical therapists, and importantly, the players and the management. If the players and the management are not supportive of your program, it's going to be very difficult to implement. So part of the process will be talking and educating these groups to understand what we're trying to do. And what we're trying to do is actually put the player back on the field, not keep the player off the field. We're just trying to get the timing right. And I think that's a very important message that you need to continually emphasize in your conversations. So the team doctor's role is really, firstly, one of education, educating yourself and educating others. Secondly, being aware, having a suspicion that any mechanism of injury involving contact and collision on the sports field may result in a concussion. So you need to be looking out for those signs and symptoms which may be important in pointing you towards a diagnosis of concussion. Recognition, removal, and referral, those are the first of the 3 R's. And I think it's important that you remember these R's: recognize, remove, refer, rest, recover, and return. Those really summarize the process in concussion management for team physicians. The recognize means be aware. You need to be looking out for the symptoms and signs of concussion. Should you have a suspected concussion, not a diagnosed concussion, just a suspected concussion, that player needs to be removed from the field of play, whether it's a training session or a competitive game, to protect the athlete from further damage and to assess them in a more controlled environment. They then need to be referred. Now that's very, very important to understand, that these players all need follow-up. So any suspected concussion needs to come through to Dr. Holzhausen Clinic. The sports medicine clinic needs to see all of these players. The question for you, which we're going to cover in the coming talks, is whether they should first go to hospital, whether they should need some CAT scanning, or whether they can be treated and monitored at home. Most of them could be monitored at home, and I don't think you need to overburden your system by sending most of these players to hospital if they are correctly managed on the field side, and that's why your role is so important. Whatever the case, once they're diagnosed, they will need rest, a period of complete rest, a period of physical rest, a period of cognitive rest, which really means you're going to have a role in managing them, keeping them out of school or university for a while, keeping them out of the work scenario, and gradually reintroducing their exposure to exercise. Their recovery will depend on their symptoms resolving, them becoming asymptomatic, having a normal examination, normal cognitive tests, and being asymptomatic when they exercise. And that's where the Sports-Related Concussion Clinic will help guide you and work with you. And then the return to play is again managed by both the clinic and the sports physician's input, as well as the team clinician. So it really is a team effort, but central to this are the initial actions of the team physicians and the integration with the Sports-Related Concussion Clinic. In terms of education modules, there are various ones available. I think Dr. Holzhausen's pointed you in the direction of the World Rugby modules, which I think are very good in terms of providing some background. Even though they have an emphasis on rugby, there are excellent lessons which apply across sports. And I think if you become familiar with these protocols and these modules, it provides an excellent background. In preparation for this meeting, I went back over them, even though I've done them several times, and again, it was an excellent refresher. So as part of your continuing education, it's worthwhile looking at these and becoming familiar with the protocols. And there are protocols here for match day medical staff, for team physicians, and for the general public, all of which I think you should read because they each give slightly different input. So I would encourage you to do this and to do it again. Let's look at those 6 R's in a little bit more detail. The recognize aspect means that you need to learn the signs and symptoms of a concussion, so you understand when an athlete might have a suspected concussion. And those are all very well detailed on the SCAT 5 protocol, with which you should become very, very familiar, which we're going to cover a bit later. But that's very important. You need to go to the Sports Concussion Assessment Tool version 5 and look at all those symptoms and signs. It's not a simple Glasgow coma scale. These are more subtle presentations, and I think both the signs and symptoms on the one hand and the potential mechanism of action, for instance, a clash of heads or an elbow to the head or a fall to the ground, must raise the suspicion of a potential concussion. Then removing the athlete. If an athlete has a concussion or even a suspected concussion, he or she must be removed from play immediately. Now, this is not always easily done as it is said, primarily because the rules of certain sports don't always allow for this. So football, for instance, soccer allows for a 3-minute on-field evaluation, which is difficult, and what we're busy challenging because we feel that sports physicians need a period off the field and perhaps some interchange play where a temporary replacement is allowed on the field should be considered. Nevertheless, I think it's your duty as doctors, if there's a suspected concussion, to remove that player from the field. And that may require some preempting. It will require some discussions beforehand with coaches and with referees to let them understand the protocols. Once they're removed from play and been assessed properly, they need to be referred to qualified healthcare professionals who are trained in evaluating and treating concussions. And Dr. Holzhausen's team will coordinate this, as I understand it. If you find that the player has certain red flags, which are going to be covered, I'm sure, numerous times during the presentations this morning, in other words, more serious symptoms and signs that point towards a potential more serious head injury or intracranial condition, they have to be referred to hospital immediately. But those are few and far between, and most players can be monitored on the side of the field, sent home with a responsible provider and someone to supervise, and then be referred to the clinic in the coming days. Everybody requires a period of rest who's been concussed, and that means rest from exercise until symptom-free, and then a graduated return to play or return to sport program. Where there's children and adolescents who are injured, you may be even a little bit more conservative with those. In terms of the recovery, full recovery from concussion is required before return to play. And this really means being symptom-free at rest and with exercise, having a normal general and neurological examination and normal cognitive assessment, which the Sports Concussion Clinic is going to implement. So they do need to be central to this decision. And then return to play, whether in rugby or soccer, requires the input of the team physician, because you need to monitor that process of gradual exercise in protocol, which is going to be covered later in the talks. This is the SCAT 5 tool I spoke about, which emanates from the latest concussion meeting. FIFA was party to putting this together, so if you are football doctors, this should be standard practice. And I think it's worth printing this off, putting it on your desktop, familiarizing yourself with it, and practicing its application. And I think that's very important, to continually practice how you implement this tool. And the more familiar you become with it, the easier it will be when you have a player who requires clinical evaluation. As a team, you need a network and support process around you, which includes an ambulance transport system, very important part of the team that needs to support you, paramedical staff, in terms of transporting players when they need to go through to hospital. You need to have an imaging unit who you can rely on for those more potentially serious injuries. Remember that most concussions don't show up on normal imaging. You need a neurosurgical unit to whom you can refer, and I know that's been identified, but you don't want to overburden this unit with concussions that don't require hospital management. So your role becomes central. The Sports Concussion Clinic, and obviously Dr. Holzhausen himself as director of that clinic, and as a telephonic and email resource to try and provide support. And I in turn will provide support to him, on an ongoing basis. But those for me are the key support aspects of the network for the Aspetar concussion program. Remember this concept of it being a treatable condition, and if you are going to be a world-class center for managing concussion, you need to utilize all your resources and the support systems at the Aspetar Center to actually intervene, not just put a question mark over a player's head and just rest them, but allow her and him the best support network possible for treating the neck, treating the balance centers, treating oculovestibular symptoms, etc. And I think what's nice for you is the expertise available to you there. For me, I keep emphasizing to myself and to others the need for education. You need to continually educate yourself, and you need to educate others. Education and this team physician are the keys to the successful implementation of this program. Don't reinvent the wheel. Use lots of the resources that are available to you. Use the modules that are already available online. Use the posters that are up there and out there and customize them. If you want, you can contact me through Dr. Holzhausen, and we can talk about some of the resources we use across different sports in this country and in others. Keep talking to yourselves, keep talking to Dr. Holzhausen, keep emailing, asking about interesting cases. And very importantly, management needs to be on your side. There's too often a gulf between the sports medicine support teams and team coaches and management. And there's sometimes a cynicism there where team management seems to think that you are trying to keep the players away from the field, and you need to breach that gulf. You need to have conversations which say we actually all are on the same side. And the way I approach that is to say that if this player has a suspected concussion and we don't identify it and we don't treat him or her properly, and they have another injury, you may lose that player for the rest of the season. If you allow me to treat this player and you give me the next week or two to manage him properly, then you can have that player back for the rest of the season. And sometimes that threat of losing the player for a long period will win you over and your concepts over to the management. And I think that's important to emphasize. The aim for all is return to sport. We are not trying to keep the players off the field. We are trying to get them back. And then in this day and age, to remember that the threat of medical legal action as well. And that's been shown very clearly in countries like America. If you do not identify a suspected concussion and manage it in ways which are now internationally recognized, then you as an individual, your sports team, and clinics like Aspetar are vulnerable in terms of your position in the law. And I think we've got to appreciate and acknowledge that. Without being paranoid, we've got to understand that there are protocols out there which define our management, and we need to be cognizant of those. Some useful resources. Aspetar, the clinic, has put information on their website and a number of good papers, and I think there was an edition of the journal that was dedicated to concussion. The World Rugby Player Welfare site we've mentioned, and then our Sports Concussion South Africa site, all have a lot of papers and a lot of information about the protocols that you could be using. There's no shortage of information to turn to. I think these are quick wins. I copied both of these posters, which I have up in my rooms and which I take to all the clubs and the schools that I work with. Nice to put them up in the change room. They are available. You can print them off and then customize them with your logos. And I would advise that you start promoting concussion management from the change room and with your sports teams. And then the second intervention are talks. I would give very simple talks, and you're welcome to use some of these slides that I've put up to your colleagues, to management, to the players. And I think you need to do that on an ongoing basis, formally and informally. Just keep talking about it. And if you can use posters which are up there and talks on an ongoing basis, it gets the information out there nicely. So to wrap up this part of the presentation, team doctors are central to sports concussion management. You as a group are going to be driving this process. But you need a network that's necessary to provide optimal clinical multimodal management. You need to drive education amongst clinicians, players, and management. And Aspetar has a program now and a network that's available for you to tap into, and that which you should do. And you're actually going to be part of the improvement in terms of the science and the clinical practice. There's a massive attention on concussion at the moment, and there's a lot of catching up to do, and that's really what you're trying to institute at the moment and come up to standard in terms of our latest protocols. So I hope this provides some background, removes some of the confusion, provides you with a basis to move forward in instituting a program from the field side right through to return to sport, based on international guidelines, using the recognize, remove, and refer protocol. And these are protocols that we're all using worldwide. So you're becoming part of a worldwide concussion network. So thanks for your attention. I said to Dr. Holzhausen, I'm happy to take any questions now and later in the morning. So you're welcome to ask, and I'll avail myself for those questions. Thank you very much.